Three signs that you will look out for. Signs I have fibroid. Three signs that you will look out for to know if you've got fibroid or not. Number one, pelvic pressure. Now, for those with fibroid, they will regularly feel as if there is something down below. There is, this sort of feeling of being full down around their pelvic region, down around their waist region, the lower abdominal region. It feels like the pressure is much. It feels like something is full around that area. Number two, you may look pregnant. Now, this depends on the size of the fibroid. If it's a fibroid that has actually grown to the point that it has even, come up into the, the abdominal region, you're going to feel pregnant. It's going to feel as if your abdomen will protrude. For some people, if the fibroid becomes too large, it comes and fills up the abdomen as though the person is pregnant. And people seeing you on the street might feel like, oh, this woman has been pregnant for long. When is she going to put to birth? Not knowing that that is fibroid. It takes the form of a baby and just stays there and grows as though it is a baby in the womb. Number three, excessive bleeding. That is, for example, during your menses. Now, you begin to see that or experience that the blood that comes out of your VJ is heavier than normal. It's too thick. It forms blood clots. So you pull your pad and what you see are thick blood clots here and there. Heavy bleeding, soaking several pads a day. It is not normal. You need to look out, for these signs. If you experience pelvic fullness, like that is around your waist region, feels always full, always painful. Number two, your abdomen starts feeling like it's protruded. Maybe that's because the fibroid has become too large, that it now grows and looks like a baby. Number three, if during your menses the flow is very heavy, very, comes with blood clots, thick, soak several parts a day, and you feel like you're being concerned, please go for a pelvic scan. That will help reveal whether it is a fibroid or not. Because if you leave these, there are complications. Number one, you can become pale because you're losing blood and not replacing it. You might not know, you might think it's in little forms, but before you know it, your blood level reduces, your hemoglobin level reduces, and you develop what is called anemia, which is, a reduction in your hemoglobin level to a certain extent that might require blood transfusion. Treatment for fibroid, the best treatment, it depends on the size and location of the fibroid. If the size is now very big, I will advise the person to go for what is called myomectomy. That is a surgical removal of this fibroid. It's not a big deal. It's not a complicated one. Take it out and feel at rest. Give yourself 6 months and then you can start trying to get pregnant. I've had questions where women ask me, after fibroid surgery, how long do I stay before I try getting pregnant? I would recommend 6 months. After 6 months, you can, try to get pregnant again. So it is better you remove it and increase your chances of getting pregnant than leave it there and, reduce the possibility of natural conception.